Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. It's Tuesday, January 6th, 2026. Happy New Year. Yesterday, a group of federal appointees working behind closed doors decided to change the CDC immunization schedule to make it more like developed world countries like Denmark or Germany or Japan. Now, we give 18 vaccines in this country, or said another way, we give vaccines to prevent 18 different diseases. So the changes that were made are as follows. They decided to keep certain core vaccines as routinely recommended vaccines, specifically the diphtheria, tetanus, acellular pertussis vaccine, the pneumococcal vaccine, the Haemophilus influenza vaccine, the inactivated polio vaccine, the measles, mumps, rubella vaccine, the chickenpox vaccine, and the human papillomavirus vaccine. So that's vaccines to prevent 11 different diseases. Now, there were some vaccines that they moved away from what had been a recommendation to shared clinical decision-making, meaning that you could reasonably choose to get or not get that vaccine. So in other words, they're basically saying that these vaccines are optional. The three vaccines that they made that decision for were rotavirus, influenza, and SARS-CoV-2, the virus that causes COVID. Now, all of those viruses are short incubation period mucosal diseases. So all of those viruses will continue to circulate. Even if everybody in the United States was vaccinated every year with those vaccines, those three viruses, rotavirus, SARS-CoV-2, and influenza would continue to circulate. The goal of those vaccines is to keep people out of the hospital, keep them out of the intensive care unit, or keep them out of the morgue. But a choice not to get a vaccine is a very real choice to suffer those infections because those viruses are continuing to circulate. So I think that that was a bad decision. The good news is that groups like the American Academy of Pediatrics, the American Academy of Family Practitioners, the American College of Obstetrics and Gynecology, and on, including states and coalitions, have continued to stand up for those vaccines and recommend them. And for the most part, I think the medical and scientific community is ignoring the CDC these days because it is run by Robert F. Kennedy Jr., who is an anti-vaccine activist and science denialist. And then the last group are the so-called high-risk group, meaning that these vaccines will only be recommended for those who are in high-risk groups, and that includes the respiratory syncytial virus vaccine, the hepatitis B vaccine, at least for those who are born to those children who are born to mothers who are not infected with hepatitis B, the hepatitis A vaccines, and then the two meningococcal vaccines, A, C, W, Y, and B. Now, what's ironic about this recommendation is that everyone is at risk for those diseases. I mean, to say, for example, we're only going to give the hepatitis A vaccine to those who are in high-risk groups, you're in a high-risk group if you eat food. I mean, the hepatitis A is usually associated with foodborne outbreaks, either centering on restaurants or imported fruits or vegetables, even homegrown fruits and vegetables. So everyone's at risk. So to say that that should just be given to high-risk groups makes no sense. In any case, I think this is unfortunate. I think what Robert F. Kennedy Jr., as head of Health and Human Services, is trying to do is he's trying to basically make vaccines optional, to say, sure, you can get vaccines, or if you can't. And as a result of his leadership, we've seen outbreaks in this country that in many ways are unprecedented. We have a measles outbreak this past year, which is bigger than anything we've seen in 33 years. We've had almost 300 children die of influenza last year. We haven't seen numbers that big since the 2009 swine flu pandemic, which was the last flu pandemic. We have even tetanus has had a number of cases this year that's far greater than anything we've seen in more than a decade. We've had at least 12 pertussis deaths, whooping cough deaths this past year in states that hadn't seen pertussis deaths in years. And this is only going to get worse. RFK Jr.'s constant war on vaccines will only make things worse. But again, I think groups like the American Academy of Pediatrics are continuing to step up and recommend these vaccines for children. And I think most pediatricians certainly pay attention to the American Academy of Pediatrics far more than they pay attention to the CDC, which unfortunately under RFK Jr.'s leadership has become a cruel joke. Thank you.